Hi guys, welcome to A to Z Medicatrix Mastery in Medical Education. In this video, we are going to discuss about syringomyelia. So, what is the meaning of syrinx? First of all, it is a tubular structure, but where this name has come? Yeah, Syrinx was one of those versatile virgins of Arcadia who, on being pursued by the Pan beside the river London, turned herself into a reed from which Pan made his pipes, so giving her name to various tubular structures, example syringes. So, here, syringomyelia. What is syringomyelia? A tubular structure or a slit-like cavity in or close to central canal of the cervical cord. In this picture you can make out, sorry guys, I draw this picture, I think you guess it. So this cylindrical part you can see in the central cord, which is called syrinx. So what could be the reason to form this tubular structure, to happen this tubular structure? I will mention in the later slides. First of all, what is the mean age of onset? Maybe around 30 years of age people may get it. And incidence if you see, average 8 people in 1 lakh per year. So here I would like to mention one more thing called syringobulbia. You can guess what is syringobulbia by now. So it is nothing but if it happens in the brain stem, then it is known as syringobulbia. Any tubular structure happens in a brain stem, which is called syringobulbia. Then it is when it comes to syringomyelia, static for many years, but then it progress fast after that. So what could be the basic causes for this syringomyelia? First of all, blocked CSF circulation, without communication of fourth ventricle, and decreased flow from basal posterior fossa to caudal space. Example, Arnold Chiari malformation. Guys, these malformations and syndromes we can discuss in the later classes. But I would like to mention what is Arnold Chiari syndrome. It is nothing but a cerebellum tonsils herniates into the foramen magnum, like it blocks the foramen magnum. The other reasons, if you see basal arachnoiditis, maybe after infections, maybe after subarachnoid hemorrhages, and other reasons are like any masses like tumor, cyst, rheumatoid pannus, or encephalocele. There are some other less common causes also. Here, syrinx means tubular structure can form after myelitis, maybe after trauma, rupture of arteriovenous malformations in the brain, or within spinal tumors as well. So these could be the basic common and less common causes for syringomyelia. Then what are the cardinal signs of syringomyelia? The first one is like dissociative sensory loss. Here you can see absent pain and touch sensation, but with the preservance of light touch, vibration sense, and joint position sense. Then other important sign is wasting and weakness of hands, like muscular wasting you can see, and weakness with or without claw hand. And other signs, if you see Horner syndrome, guys, we can discuss this syndrome later class. And body symmetry may alter, means body asymmetry. And syringobulbia we have discussed in the earlier slide. And Charcot's joints means neuropathic joints. And diagnosis, if you see, MRI is the best one. Like we can make out how big is the syrinx. And the treatment plan, if you see, surgical intervention is the main doctor's advice. They don't wait till the disease progresses for long time. They, after diagnosis, immediately they advise for surgical intervention. It can relieve the pain, and it stops the progression. So we summarize, guys. Like syringomyelia is nothing but there is a tubular structure in the central cord. The causes, if you see, there must be the CSF circulation block, and decreased flow to the caudal space, and Arnold Cherry malformation. So these could be the some common causes like tumors, etc. And cardinal signs, if you see, dissociative sensory loss like absent pain and touch sensation, wasting and weakness of hand muscles, and the diagnosis is MRI and treatment is surgical intervention. Thank you guys. Hope this video is uh, helpful for you. Last but not the least, I would like to mention, so sometimes in exams they may ask, like when asked for the syringomyelia, they may ask the associated malformation. Here you can remember this is Arnold-Chiari syndrome. About Arnold-Chiari syndrome we can discuss later. And they may ask you questions like when they ask about the sensory loss, they may ask what could be the preserved joint position sense, whether it is absent or present in the particular syringomyelia. So these kind of questions can be asked in the competitive exams. Hope this video is helpful for you. Thank you. Thank you so much.